A mother-in-law found the perfect match for a kidney in her son-in-law. While saving her life, he became the first living donor in Central PA to have an innovative new robotic procedure. Fox 43's Sarah Williams tells us how this new state-of-the-art machine is saving lives.
Well, you changed my life. You changed my life every day.
Someone in my family needed my help, and I wanted to raise my hand and be there for them.
Eduardo said he wanted to do everything he could to keep his mother-in-law alive and healthy, even if it meant becoming the first patient to undergo a new operation.
Eduardo had a robotic donor nephrectomy. So while the surgeon operated on this surgeon's console, their hands controlled the instruments on this patient cart on the table.
So this is the Da Vinci. This is called the surgeon console. And we can see 3D inside of these viewers. And we use these instruments here to manipulate the instruments at the patient.
Adjust port position and check patient clearance.
UPMC Dr. Danielle Lady was Eduardo's transplant surgeon and also shares the title of being the first in the area to be a part of this procedure. She says it takes years of training to use the Da Vinci.
So the equipment attached to the Da Vinci has ports that go inside the patient, and there are tubes that allow the instruments to go in and out.
Traditionally, living donor nephrectomies have been performed using either a laparoscopic technique or open surgery.
So your kidneys are way in the back, so we go through the abdomen to get to the kidneys.
The Da Vinci robotic system allows surgeons to perform minimally invasive living donor surgical procedures with increased precision, less tissue damage, and better visualization, providing easier access to areas that are hard to reach.
Install the endoscope for targeting.
It's a more delicate and a finer approach to manipulation of the tissues.
And while Eduardo was the first one to undergo this living donor robotic nephrectomy,
it went really stellar, and he did a great job.
UPMC has had 6 nephrectomies using the robots so far, who have all been discharged on the same day. Doctors and patients looking for donors hope this new technique will increase the likelihood of organ donations.
Anybody who's healthy can donate a kidney. Patients who are on dialysis, who have kidney failure, are often on dialysis for years and years waiting for a kidney. Not only we're helping the recipient get a kidney, but we're letting the donors get back on track a lot quicker.
And more than 90,000 people in the U.S. are waiting for a kidney transplant, and that's according to UPMC. Marshall?
Sarah, what are some of the benefits of using this Da Vinci to complete a living donor nephrectomy?
Yeah, so the benefits of the robotic surgery have been extensive, researched, gone into it, and they include a reduction in blood loss, less post-operative discomfort, and a quicker recovery. Now, robotic surgeries enable smaller incisions into the lower abdomen, which also decreases the risk of hernia and infection. This changes the approach to kidney donations, especially in living donor kidney donations, because it allows for a person to be back on their feet in a short amount of time. And living donations can be anyone. It can be family members, a friend, a coworker, or even a stranger.
Very cool technology, Sarah. Thank you so much.